Richard Maxwell used to love sport, playing rugby and wrestling with his two sons, but no longer. These days, instead of playing rough and tumble with his kids, they push him around in a wheelchair. Richard had an accident 5 years ago and he thinks he should be entitled to accident compensation. And the country's experts on spinal injury agree. But sadly for the Maxwell family, the ACC decided it's all in his mind. Anna Kenner with the story.
Richard Maxwell is paralysed. The former hospital orderly who once looked after others now needs 24-hour care himself. Nearly all of it provided by his wife Cherie.
1, 2, 3.
But the pain and even the loss of his legs he can cope with. What he can't deal with, just can't understand, is the way he's been treated by ACC.
I feel like I'm on trial all the time, trying to prove that there's something wrong with me. When they know there's something wrong with me, they examine me, they stick needles in me. I've had doctors stick paper clips in me to the point where they've drawn blood trying to get me to flinch, and I just can't feel it. And no matter what you tell them, they just don't believe you.
For 3 years, Richard Maxwell's been told his paralysis is all in his mind. That's the view of ACC after it hired a doctor to read Richard's file. Although one of the country's leading spinal specialists disagreed, ACC stuck to its guns, leaving Richard Maxwell to live with the consequences.
I can't get in the bathroom here. I've got to go out the garage on a commode. I've got to get my wife to come out and help me. A couple of weeks ago I tried to get on the commode chair and I just fell straight down and landed on the concrete, and I ended up in bed for I don't know how long, just absolute agony. So far I've been bitten on the backside 4 or 5 times by spiders. I've got scars. I ended up in hospital for a week or 2 because I had infected ulcers on my backside from spider bites. There's no respect, I lost all that. It's like taking a man's soul and just throwing it out the door.
5 years ago, Richard Maxwell was an active husband and father. Now he's forced to be a spectator in his children's lives. Sidelined not only by his disability, but by ACC's refusal to acknowledge it. The drama began in 1998 when Richard was working as an orderly at Masterton Hospital. One evening, short-staffed, he was called on to help unload an ambulance patient.
We had a female ambulance driver and a female nurse helped me lift a lady off the ambulance in a stretcher. So when we sort of got her out of the ambulance, the ladies just misjudged the weight and sort of dropped her just for a split second. That's all it took. Bang.
The once fit and active Richard Maxwell, seen here in a home video just a year before he became paralysed, was off work for months, constantly in pain. Finally, he returned to work.
2 weeks later, I was at work coming down the stairs from one of the wards and I just collapsed. It's like being hit in the backside by fork lightning that just went everywhere. Just branched off down my legs, up my back, everywhere. It's a pain you just can't describe.
Richard was given a desk job at the hospital.
But it made me feel as though I was still contributing something, which was one of the main things, and I was always pushing to go back to work. I didn't want to stay home.
Now he's totally housebound, negotiating his way around his cramped home, as well as the complexities of ACC. The reason he's in a wheelchair at all, Richard believes, dates back to his first encounter with a doctor ACC sent him to.
When I'd bend down as far as I could, to where I could bear the pain, he'd put his hand on my back and sort of push me just that little bit further, which I couldn't really do. And then he'd sort of push you a little bit more until you, ah.
Richard left the appointment in tears and had to go to the chemist next door to get some Panadol.
I ended up laying down in the back seat on the drive home. Yeah, when we got home, I got into bed, and that was the last I ever felt my legs again, more or less.
What did it feel like the day you realised you had no feeling in your legs?
I was frightened. I was scared to death. I mean, woke up in the morning and, you know, beside my lovely wife like I normally do, and I went to sit up and I couldn't. And I said to my wife, I said, I can't feel anything. You know, it's just incredible.
Cherie put in a call to the hospital and Richard's GP, but the couple were told they'd just have to manage.
The person's just gone paralysed. They don't know what's happening to their body. My bladder closed down, everything, and they say, oh, just deal with it for 5 weeks until you go to the Burwood Spinal.
So how did you deal with it?
I didn't. I went to pieces. I had to go up the hospital in the end and be catheterised because my bladder wouldn't work. I was in pain. My family was going to pieces. My wife didn't know what to do. She was trying to care for me. My kids were panicking and thinking that their father was dying. Or bossy bitches. It's like dodging cars, bang bang.
Today, despite the shortcomings of their home, the Maxwells cope as best they can. Routines have become second nature. But 3 years ago, when Richard was first paralysed, the shock and stress on his wife and family was enormous.
I had to borrow a wheelchair to get around the house. To shower, Cherie would, first she started carrying me and putting me on a chair in the shower, but she started getting sore hips and sore back and that herself. And I refused to let her carry me after that, so she used to put me on the floor and I'd drag myself into the shower and sit on the floor with the shower in the shower tray, have a shower. It's the only way we could do it. I felt like an animal.
ACC's decision to limit their help for Richard was based on a crucial medical opinion from Professor Des Gorman. Professor Gorman heads the School of Occupational Medicine at Auckland University. He made his diagnosis after reading medical opinions in Richard's file. On the basis of Professor Gorman's report, ACC told Richard his symptoms were not directly accident-related, that they may be due to a conversion or somatoform disorder. In other words, Richard's paralysis was mental rather than physical.
We don't believe there's a psychiatric diagnosis here.
Right. What's this? Oh, look at you. Isn't it fantastic?
Dr. Richard Ackland is Clinical Director of the Burwood Spinal Unit in Christchurch. He's treated Richard Maxwell during several visits there.
No, that's great. That's marvellous to see. All right. His is a diagnosis of paraplegia of unknown origin. And the unknown origin is purely that our style of investigation hasn't picked up any structural damage. Having said that, we don't understand what is the cause of this, but to say it's mental, that it's conversion or hysteria is a very dangerous thing.
By the time I got to Burwood, I was almost convinced by ACC in Marsden Hospital that I did have a mental health problem. I was almost convinced myself.
Most patients who come to Burwood have clear spinal damage, most often caused by road accidents, falls and sporting injuries. But Dr. Ackland says about once a year they get a case like Richard's, where neurologists have found inconsistencies. But he says that doesn't mean the paraplegia is all in the mind.
Do I sometimes wish that I actually broke it and the doctors could see a shattered spine or something? Yeah. I mean, I'm paralysed, it doesn't make any difference to me.
I think it's clear cut that it was a result of an injury in the first instance.
Dr. Ackland has written to ACC saying they should cover Richard's care, but they declined, based on the opinion of Professor Gorman.
He wrote a report saying that he believed it was a psychosomatica disorder, which is unfounded. I mean, the guy's never met me, he's never examined me, he's never spoken to me. He wouldn't know me if he fell over me in the street, yet he can read a couple bits of paper and sit there and make a diagnosis.
ACC hired 2 psychiatrists to interview Richard, but both said they could find no clear evidence his paralysis was all in his mind. But still, ACC wasn't satisfied.
Mr. Maxwell's disability cannot be shown to be related to an accident, and so ACC does not have an obligation to support him.
Dr. David Rankin of ACC. On the basis of probabilities, it seems fairly clear that a man was well before he had his work accident. He is now paraplegic. It was a progression of that injury. Haven't you got some discretion here?
Every New Zealander that hurts their back was well before they hurt their back. Every New Zealander with a back injury does not go on to have paraplegia. So we cannot say the 2 instances are related.
Yes, you do.
Despite this hard line, ACC is helping Richard to a limited extent, supplying a wheelchair and paying for him to be transported to a private hospital 3 days a week for a shower. But what he really needs is for his home to be made wheelchair safe. So you think this ramp's a bit makeshift?
It's too steep. I've had many accidents going up and down on my own. I don't feel safe unless someone's either pushing me down or pushing me up. It's just too steep for me.
And the doorway here looks pretty narrow. Is that a bit
The doorway's very hard to get in and out of. My father-in-law made this little ramp here, but it's really hard to get in and out on my own.
Takes a bit of muscle power, Cherie.
Yeah, without jarring myself.
But ACC seems uncertain about its obligations. 3 times Richard's been assessed for a new wheelchair and car. Twice plans have been drawn up for house alterations. These plans that were drawn up to modify the house, what were they talking of doing?
Widen most doorways because he can't get through. He can't get in our lounge passage, the front door, to put a decking down to even up the floor and a ramp for his wheelchair, to put an ensuite in his bedroom and extend our bedroom to make it easier for him.
And what was the latest reason for that to be all called off?
Richard has to prove there's a physical link between his paralysation to his original injury.
As soon as we can demonstrate that ACC has an obligation to support this man, we can, the next day, call in the builders to make sure that we get things on track.
How do you feel when you're home on your own and Cherie's out doing stuff with the kids?
Left out. That's when you sort of think, well, why the hell hang around? You're not good to anybody.
How's it affected your relationship with your children?
It's made it really hard. We're having a few problems with the oldest son. I think he's finding it very hard to cope with. I mean, he's gone from having a father that used to play rugby and kick a ball around with him and wrestle with him in the front yard to one that he's got to try and push out the front door and help get out of bed and empty his bag for him because I can't get in the toilet to do it myself. It's no life for a kid.
When we come back, a surprising development. We talk to the ACC's medical consultant. For 3 years, Richard Maxwell's been confined to a wheelchair, but ACC hasn't given him the compensation he believes he's entitled to. The corporation turned him down after receiving a report from its medical consultant. But while we were filming this story, something unexpected happened. Something that could give Richard and his long-suffering family a glimmer of hope.
Richard Maxwell's not sitting around waiting for miracles.
1, 2, 3.
While he battles with ACC, he's doing what he can to keep himself in shape. Conscious that everything he wants to do, Cherie must be involved. She cares for her husband 24/7, but gets paid by ACC for just 3 hours a week.
Wow.
Must be tough on you.
It is, but I do it because I love him.
Cherie says every setback with ACC weighs heavily on Richard.
He used to be so jovial and easy to talk to, but he's just lost his will. He wants to give up. He's had it.
What's the most distressing thing for you as Richard's partner, knowing the man he once was?
What it's doing to him. To know that his life's, that he wants to end it sometimes.
We have a logical right to ask whether or not this man's paraplegia is related to his back injury. He has never had.
Dr. Rankin says the health system should be caring for Richard Maxwell.
And the courts are in
He says ACC's already done more than it's legally obliged to.
independent way of determining. We have continued to fund assessments to try and find a specialist, any specialist, that will tell us the cause of this man's injury so that we can support him.
You are not going to get a definitive medical opinion on this, and you know it.
We don't know it.
Richard Maxwell is worried about his future. He's struggling to live and raise 3 children on just $315 a week. And to add insult to injury, he's worried the lack of support has further compromised his chances of walking again. So is there a sense that by invalidating your paralysis and not treating it, it's been allowed to
Get worse. I'm convinced of it. I have deteriorated from the time that I was discharged from Burwood Hospital.
This man's got a lot of stressors as a result of the way his case has been handled, and that's compounding his clinical presentation.
How would you sum up the way he's been treated?
Oh, I don't think we can be proud of it.
But amazingly in this case, there is an unexpected development. Before we started filming Richard's story, I contacted Professor Gorman to tell him of our investigation. While in Masterton, I rang him again asking for comment.
Well, what happened during that phone call was just extraordinary. Professor Gorman, whose medical opinions ACC has used to justify its treatment of Richard, is now saying it's a big mistake. He says, as far as he's concerned, Richard's paralysis is related to his original back injury and that ACC has been mischievous and misused his report.
Immediately after he spoke to me, Professor Gorman rang Richard.
He's a man that has been quite happy to destroy my life by a report that he's written by never meeting me or examining me or doing anything for ACC. And he's ringing me out of the blue after 3 years. And I just couldn't believe it.
Back in Auckland, we asked Professor Gorman why he changed his mind. He said he hadn't.
If I was asked this question 3 years ago, I'd have given exactly the same answer I'm giving to you today.
So do you believe that Mr. Maxwell's paraplegia is a direct result of his work injury?
The answer to your question is yes, and that answer applies whether I think Mr. Maxwell's paraplegia is a consequence of his mental health, in other words, his dissociation because of the problems he's experienced, or whether I think it's because of an injury to his spinal cord or some part of his nervous system.
Professor Gorman says ACC was free to interpret his report in any way they saw fit. But he disagrees with their interpretation in Richard's case. Mr. Maxwell still sees you as being the villain of the piece. He says you've destroyed his life.
I don't make ACC's decisions. I write medical reports. I write them objectively. And I write reports which, I may add, very frequently do not result in people being entitled or disentitled. We don't have any particular bias when we write reports. We try our very best to be objective, but they're medical reports. They're nothing more than medical reports, and they never will be.
What I've gone through has been the hardest thing that a family should ever have to go through. But I'm lucky in the sense that I've had a family to help me go through it. Imagine if it was someone who didn't have a family. You know, why should anybody else go through what I've gone through?
The ACC say if Professor Gorman writes a new report making the link between Richard's back injury and his paraplegia, then they'll be happy to review the case. In the meantime, they're sending him to see another neurologist for more tests. Next up, parents who favour one child over another.